Barry Weiss's publication.
The Free Press.
The Free Press.
The Free Press, Vinay Prasad had a response to RFK Jr.'s claims, which was published.
Yeah.
Show it here?
Yeah, let's show it. And it's called What RFK Gets Right. And
what RFK Jr. gets right and what he gets wrong. I think the subtitle is even more interesting. Dr. Vinay Prasad fact checks the presidential candidate on vaccines, regulatory capture, and more.
Yep. Now, this is interesting. And of course, Vinay is true to form, quite good in some places, and surprisingly immune to seeing the same sorts of shenanigans in other places. And I do not know. I truly think Vinay seems like a good guy, but I can't figure out why the pattern is what it is. It is conspicuously off. In particular, Zach, do you want to show? So Vinay goes through this fact check of RFK Jr. And then, of course, Alex Marinos.
Well, before we go to Alex Marinos, so he specifically takes on ivermectin and hydroxychloroquine, and then also childhood vaccines. So before you talk about what Alex Marinos had to say about Vinay Prasad's fact check as published in the Free Press, the link. So he has two links to ivermectin that he proposes as evidence that ivermectin doesn't work. Here's the first one, Zach. If you would show this, the first link is to the U.S. FDA article from a couple years ago, Why You Should Not Use Ivermectin to Treat or Prevent COVID-19, with a picture of, that's right, a horse. Like literally he's linking to an FDA article from before most of the trials were even done. And in fact, the article says like trials are ongoing. So A, this isn't the smoking gun Prasad would have you believe it to be. B, it's using that same old crazy PR campaign about its horse medicine, right? Like I cannot believe they're still doing this, but that Prasad actually links to it. And the Free Press lets him do it. Like I would like to see the supposed evidence. And of course, Marinos will, destroy it as he has done over and over again. But seriously, you link to an outdated FDA article with aspersions to horse medicine in it as your evidence that ivermectin doesn't work. Not very strong evidence. Doesn't look like fact-checking to me.
Yeah. And, there was a massive campaign to cause the public to see ivermectin as especially veterinary in nature, right? Exactly. Horse paste, right? That was what was done to ivermectin. Yep. Now, the question is, why? Now, let's show Alex's tweet thread. Yeah. So Alex fact checks Prasad and, of course, dismantles this argument where Prasad says, with respect to ivermectin and hydroxychloroquine, RFK Jr. got it wrong. And I cannot read at this distance. You want to read the first several tweets. You don't have to read the quote.
You want me to?
Yeah,
okay.
Can you?
But you have to start at the beginning, I think, Zach. You want to
scroll back up.
So here, Marinos has an image from the relevant part of the Prasad article in the Free Press. Ivermectin and hydroxychloroquine got it wrong with regard to Kennedy getting it wrong. Reminder, writes Marinos, Vinay Prasad, MD, MPH, asserts that ultimately ivermectin doesn't treat COVID-19. This despite the fact that the meta-analysis he bases this on, when updated, and despite absurdly tight filters, is just one RCT, randomized control trial, away from showing a statistically significant mortality benefit. Let's scroll down. Dad wants me to read a few more. He started making these claims in a post on his Substack, comparing ivermectin and masks, and claiming that since both do not clear the statistically significant barrier in the meta-analyses of his choice, ivermectin should be considered a failed therapy. Of course, the ivermectin meta-analysis he chose is measuring mortality benefit when ivermectin is given as early or late treatment. In the case of masks, they're measuring infections when used as prophylaxis. Why didn't his chosen meta-analysis on ivermectin also investigate ivermectin as prophylaxis? You want me to keep going?
Yep, I think one more.
Even stranger, writes Marinos, if we look at the pre-registration of the Marcolino meta-analysis, which Dr. Prasad relies on for his analysis, it promised to look at prophylactic studies too. So what happened with that result? Why didn't Vinay compare like for like?
Okay, keep going.
One more?
Yeah.
Well, this meta-analysis registered that they would analyze prophylaxis and treatment. For treatment, they list 16 endpoints. Prophylaxis literally vanished. No mention in the paper. Of registered treatment endpoints, they only presented 1 out of 16, mortality.
All right, so I want to sort through what's going on here. First off, you have a process whereby, actually, let's start somewhere different. What I want to know is, for the folks who find themselves, yes, acknowledging that lab leak appears to be the likely explanation for COVID, and yes, the vaccines did not turn out to be effective at controlling the disease, and yes, there's a large adverse event signal that we didn't know about at first, right? But ivermectin doesn't work, right? That series. Yep. The question is, why are you landing there, right? For one thing, you have just seen a series of revelations that make quite plain that the system does not function to test the safety and effectiveness of therapeutics in a way that is reliable. So to then point to the same system's product and say, well, with respect to ivermectin, we know, yes, it was promising at the beginning, but then it turned out that it didn't work. Well, here's the thought experiment I want people to run.
Yep.
Take yourself back to your mindset before COVID, right? What did you think before COVID? What did you think about pharma, what we called big pharma? Did you think big pharma could be trusted with your health, or did you think it needed to be carefully watched because the profit motive made it unreliable? Okay, so in such a mindset, your pre-COVID mindset, ask yourself the question: suppose that there were literally hundreds of billions of dollars to be made on some new platform therapeutics that would be impossible to deploy if there was an existing drug that was both safe and effective at treating COVID. In that case, do you expect pharma to allow that other therapeutic to prevent the accumulation of hundreds of billions of dollars and to allow this drug, especially a cheap
generic
drug out of patent, delivered around the world, unusually safe, like safer than lots of drugs in your medicine cabinet? Do you expect pharma to forego the hundreds of billions of dollars, or do you expect them to in some way attempt to create the impression that this other drug doesn't work, right? So in that thought experiment, I think you would come up with the idea that, oh, geez, I guess I would imagine pharma might take some action to try to derail the impression of effectiveness, especially in light of the EUA, which requires that there not be a therapeutic. So it really is a binary in this case. Either there is a therapeutic, in which case you don't get to deploy mRNA vaccines, for example, or there isn't a therapeutic, in which case you do. And there are lots of benefits there, not just the money that was made in COVID, but you've got a platform that isn't yet ready for prime time that you can...
lots of people are into mRNA vaccines.
Yeah, you can speed it through the regulatory apparatus. You can get people widely accepting of this new technology, which they might have been rightly skeptical of if it had been presented to them correctly. So you've got a huge incentive for pharma, if something like ivermectin or hydroxychloroquine works, to find reasons to think that it doesn't or can't be used, right? Okay, so you've got these two compounds, hydroxychloroquine and ivermectin, and you might say, well, the prediction of the pharma corruption hypothesis is that if you look into the work that does tell us that hydroxychloroquine and ivermectin don't work, that you will find shenanigans. Right? And if you find shenanigans, then maybe the idea is pharma is driving this. And if you don't find shenanigans, then maybe they don't work. Right? This is actually a place where I will gently fact check RFK Jr. also. He said during the Rogan podcast, I think he just made a mistake, and I'm sure he's very good about correcting stuff when you talk to him about it. But he said that in the case of ivermectin and hydroxychloroquine, very high doses were given, enough to be toxic. That's certainly true for hydroxychloroquine. The problem is it doesn't even work that way for ivermectin because it's such a non-toxic drug that giving a dose that would produce a toxic consequence is very difficult. So that did not happen with ivermectin. It did happen with hydroxychloroquine. They gave absurdly high doses. So, okay, that's one kind of shenanigans that you see. But what Alex is pointing out here in his thread is, and it's far from the only one, but it is the shenanigans that you see when you look into the ivermectin trials. So you've got, by his description, you've got Prasad defaulting to a meta-analysis in which ivermectin is dealt with as a treatment, right? And the endpoint that is chosen is death. Right. Is ivermectin preventing death? Now, death is a very important thing to prevent, right? But the problem with using that as an endpoint for the study is that COVID isn't sufficiently lethal to get a large sample. So you can say this was a large randomized controlled trial, but the number of people who reach a relevant endpoint and therefore allow you to see this is extremely low. And so I want to give an analogy so people can see this crystal clear. Suppose that we tested the efficacy of Neosporin and that we use the endpoint of death, right? So what we do is let's do a large study because, heck, we want to really know.
The efficacy of Neosporin on new cuts.
New cuts, right. So we get 1 million people, and we put half of them in the control group, and we put half of them in the treatment group.
Do we let them cut themselves? Or?
Oh, they're going to go out into the world, and we're going to, I don't know, encourage them to engage in reckless behavior in which they may receive a laceration at any moment.
Excellent.
And excellent. This is good stuff, man. So, okay, so they go out into the world and they start getting cuts, as people do. And as soon as they get a cut, they're forced to call in and we rush them to the hospital. And if they're in the treatment group, we apply Neosporin to their cut. And if they are not in the treatment group, the people doing the applying don't know, but the researchers in the back room who know who's in what group hand out.
It's Vaseline versus Neosporin.
There you go.
Clean it all. You wash it with soap and water, and then you either put some Vaseline or some Neosporin on. Okay.
Right. Okay. And at the end of the study, here's what we're going to find out. Neosporin is not effective
at preventing death.
No, it's not effective. We're just going to say we're going to stop at not effective. What we've done in order to determine if it's effective is we've looked at its consequence for death. Right. But we've determined it is not effective, and therefore we are going to mock anybody who says, "Oh no, it is effective." Right. So that is a ridiculous shenanigan. Okay. In the case of COVID, it's slightly less ridiculous because people do die of it, but the point is most people do not die of this, and therefore by choosing that endpoint, you have already suggested what you're hoping to find. Now, worse, so in order to prevent shenanigans like this, you're supposed to register your endpoints ahead of time so that you cannot, in the end, go back and shuffle what you did and cherry pick a result here and there, right?
Especially, they almost hit 20, right? Like they had 16 possible endpoints and they reported 1. And I don't know, maybe it was medical. I haven't gone back and looked. Maybe it was medical and said their p-value they were shooting for was 0.01, but it was 0.05. And they had 16 original endpoints. They reported 1. Like that looks very, very dicey right there because the chances that one of them would not be effective was really close to 100%.
Right. So to put this in lay terms, if you said, I want to know if ivermectin's going to work, and here are 16 different measures that we're going to make. We're going to take all the data. We're going to look at what it is, and we'll probably get a mixture, right? And then the point is, you only report 1. Oh, which one did you report? Was it the days till recovery? Right. No, you chose death, which therefore makes the bar incredibly high. And the study.
But everyone who's not paying close attention or hasn't thought about these things, like, well, I care about whether or not I die, don't I? Why would you tell them they shouldn't care about death?
Right. But
no, it's about the bar height. It's
about the bar height. And it is about when you suggest 16 things that you're going to measure in order to find out once and for all whether ivermectin works. And then you report 1 and you've chosen the one with the high bar and you didn't report the other. So we can't even look at it and figure out, well, why didn't you report it? Right. So, the point is this smells a lot like bullshit. Right. And the thing is, it's not alone. Every time you look into the stuff on which these claims of ivermectin's failure to be effective are based, you find similar bullshit. You will find a discussion in my recent talk with Dr. Corey about the extremely arbitrary cutoff in the dosage protocol in the Together trial and the Active 6 trial, where COVID, a disease that disproportionately affects people who are obese, where instead of continuing to increase the dose with body weight as you're supposed to with ivermectin, they put an arbitrary weight cutoff so that the most
I believe that Marinos was the first person to reveal this as well. Yeah.
So the point is, go back to your pre-COVID mindset, right? Pharma cannot be trusted. Right? Pharma cannot be trusted. And if there's hundreds of billions of dollars at stake and a couple of generic drugs might get in the way, you might expect pharma to do what it can to slander those drugs, to mock people who have used them to good effect, right? You would expect those shenanigans. What should you do when you expect those shenanigans? You should look into the studies and the meta-analyses that say that the things don't work and see if you find bullshit.
Yep.
And it's like, oh, it's amazing how much bullshit they actually jammed into those things, right? It's like inconceivable how much bullshit there is in the ivermectin and hydroxychloroquine trials, deadly bullshit in the hydroxychloroquine trials.
Yep.
And so anyway, that's the question. And so the real upshot here is not pharma. It's not the regulatory apparatus. I think that what we have found is an educational scandal. All of these folks who think, yeah, okay, maybe it was lab leak, and all right, maybe the vaccines weren't effective, and it turns out they're way less safe than we thought, but ivermectin doesn't work, right? Where did these people go to college? Because I think that place needs to be shut down. That place did not teach these people how logic works. It didn't teach them how to pursue a correct answer. And
but
frankly,
I think some of them were allowed to handle glassware and run experiments on expensive machines.
Well, no doubt, but nonetheless,
so, that gave them what they needed.
I mean, okay. All right. Maybe we can't shut down this faulty institution, but I would think actually a lot of these people who appear not to be able to follow through to a logical conclusion once they've seen a pattern like this might have a cause of action against the institution, whatever it might be. And so I don't know, maybe they should seek justice.
Yeah, maybe they should. Maybe they should. Okay. Okay, so I want to talk about one more thing.
Can I add one more thing on that topic before we go?
We're not going yet. I have some things to talk about here.
Before we move on is what I meant. Here's the analogy that I think represents where these people are falling out and how absurd it is. Imagine that you were, you had a corporation and you wanted to build a big corporate campus, and you hired an engineering firm, and the engineering firm gave you designs, and you built an office tower, and you built a parking garage and a bridge to allow people to drive in over the beautiful, majestic ravine at the edge of your campus. And one day, your office tower falls down. And when one looks into the matter, one finds that actually at an engineering level, it was not designed to be robust, and it looks like the plans were full of nonsense and
rainbows, maybe unicorns.
Who knows what it is? Somehow the engineering firm is guilty of gross negligence when it comes to the office tower. It just was not designed to withstand the forces on it. And when you look into the parking garage, it turns out it's also not capable of withstanding.
Designed and built by the same people, same time.
Oh my goodness.
Yeah.
Yeah, not good. They're going to have to tear that thing down. It can't even be retrofitted.
But it's got cars in it, Brett.
We're
using it.
They'll pull the cars out somehow.
But we are using it.
We are using it. But the bridge, everybody's still, as they're going in to help tear down the parking garage, they're driving in over the bridge. The assumption is, well, the bridge was built by experts, right? They did all the engineering. Here are the blueprints. And the question is, well, why, now that you've seen the office tower fall down and you've discovered that the parking garage is badly designed, do you still trust the goddamn bridge? right? Why is anybody trusting a system that failed them so much across the board on these other topics when it comes to repurposed drugs? And that, I think, is just, it's a strange mystery.
Yeah.
Right?
It is.
It's just odd. It's conspicuous.
It's conspicuous. And I guess actually the other link that Prasad gives in his piece published in the Free Press, fact-checking RFK, his conversation with Rogan this last week. The other ivermectin, the first ivermectin link goes to an FDA article that has a picture of a horse proudly displayed on the front of it. And the other one goes to a popular article in Washington Post that itself links to other popular articles like the Wall Street Journal. And it's just a bunch of claims. Like, this doesn't work. Okay, but that's not how science works. That's not how evidence works. It's not, this journalist over here said X. Oh, I can quote that journalist over there saying X. Well, the Washington Post said X. Like, this is the opposite of how science is supposed to work. And frankly, it's embarrassing. It should be embarrassing for someone claiming to be fact-checking, someone claiming to be acting as a medical doctor, as a scientist, to be fact-checking medical and scientific claims, to be using the Washington Post and an old article in the FDA as evidence of the fact check. It's not. And, he knows that.